And they won't be able to set lifetime limits on our coverage so that if we get catastrophically ill, we won't have to lose our house, our business, our farm. So that's what's in the Senate bill, and that's what we're fighting for. And that's just the earth-shattering part. There are so many good things in this bill. We're going to have doctors in rural communities, and Medicare's going to pay better, and we've got all kinds of stuff. A program that will allow us to sign up for long-term care insurance on a public program. This bill is great. So there's information in the back about what's in it, and there will be information about what we're fighting for, what we're taking up this March to the Finish Line for Melanie about at the Jobs with Justice website, the Missouri Healthcare for All website, and also there's already good information on the Missouri Budget Project website, which Ruth Ayersman wrote. She's here somewhere. So all of these are things that we have to fight for. And if this bill doesn't go to the president's desk, it's going to take us years and years and millions of dollars to try to get it piece by piece. All of those things are one House vote away from becoming law. One House vote. The Senate bill gets passed by the House, it goes to the president's desk. Then we do legislation to make it even better. All of these significant victories have powerful opponents, and that's why the bill's been so fiercely attacked. So Melanie wanted a political rally and not a funeral, so the call to action. In her honor and memory, each of us must make passing comprehensive health reform a daily task until the bill is on the president's desk. We must call Congress daily. We have to create such a mandate and buzz that Congress realizes the dire political consequences if they walk away with nothing. If they walk away from this opportunity without a bill, without any changes to our healthcare system that significantly advance the situation we find ourselves in, then Congress should be afraid to come home. It should be afraid. As we go out and have coffee and cookies and network, there are going to be people with clipboards. And those clipboards are going to get your information, but they're also going to ask you to think about 3 things that we can do within the next week to actually bring this to the finish line. It's going to be really important for you to give the folks with clipboards your full name, phone numbers, and emails, because some of what we're planning, we don't have every detail. I can't tell you exactly where to go. I can tell you where we're thinking it's going to be and what time it's going to be, but we want to be able to get in touch with you and make sure we can get you there. So this Wednesday, February 17th, a local leader stepped up to plan an HCAN action outside of Anthem Wellpoint at 18th and Chestnut downtown. That's Kurt. Kurt, are you here? Wait. Kurt responded in our wonderful e-organizing to HCAN saying, we want events on the 17th. Melanie went outside of Wellpoint Anthem and told her story. Looking at those insurance executives twice. We're going to go back a 3rd time for it. Melanie even tried to go in to talk to them about what we think they need to do to get out of the way of health reform, but they were too afraid of her. They wouldn't even let her in the door. It was her and a minister and a doctor, and that was too much of a threat for Wellpoint Anthem. So Kurt is planning something at 4 p.m. this Wednesday. If you can come to that, bring people, help us populate that rally, even be a speaker yourself, sign up on that clipboard, check that box, and Kurt or someone from this organization will be in touch and give you an opportunity to fully participate. This Friday, the 19th, so this is in the evening in the city, we'll be creating a memorial dedicated to Melanie and to all our friends and family who have suffered or died under the current insurance system. We're going to be rallying to remember them in downtown Clayton, near Brentwood and Bonham, near Shaw Park. And we need you to sign up so we can give you the exact location. We're literally creating a memorial, so think hard about the folks that we've lost. Who have you lost? Who is it that's sick because they didn't have health insurance when they needed or they couldn't access care? And what will you bring that represents them? A photo, a memento, some writing. We're literally going to create a monument that we can build and show Congress that there are lives on the line and we can't afford not to get this done. So that'll be Friday the 19th. And then the amazing one, the March to the Finish Line for Melanie. So it's really hard because this was literally just planned, but if there are folks in this room who want to work together to go to Washington, D.C., and take part in the March to the Finish Line for Melanie, People are leaving out of Philadelphia, and they're going through Philadelphia, Delaware, and Maryland, and marching from the 17th through the 24th, arriving in D.C. at the 24th. When we get to D.C., it's going to be exactly when President Obama started his healthcare summit. So it's Melanie's story and the stories of all the folks like Melanie that are going to be there to launch the summit and to make sure that we set the tone for the families and lives that are on the line that will require Congress to get this all the way done. So those are 3 things. There will be many, many more. One of the things that I love most about Melanie is that she was a movement thinker, as everyone has said. We'll be in discussions about what was going on, what to do, and she'd be talking about history, quoting Abraham Lincoln, Dr. King, President Roosevelt. It was always amazing. And I've been lately on a Gandhi kick. And maybe because I really need to become a pacifist after 3 years in this battle. But my favorite quote from Gandhi is something that really helps me calibrate the movement and figure out where we are in this immense struggle. And what it means each time something amazing happens, whether it's amazingly threatening to our goals or something that advances them. And Gandhi said, describing the struggle, first they ignore us, then they ridicule us, then they fight us, then we win. So, clearly they're not ignoring us. The ridicule has died down a little, but we are in this fierce and deep and costly, high-stakes part of the movement to significantly advance our healthcare rights. We are so close that our opponents are fighting like never before. So if we fight steadily enough and smart enough with discipline and commitment, just like Melanie has for her whole life since she was 7 years old, we can cross this threshold and we can win. So this is the call to action. We're going to sign up. We're going to sign up on those clipboards. We're going to talk to all of our neighbors, all of our friends, all of our family, all of our coworkers. And I want to know, for Melanie, can we hear a yes we can?
Yeah!